So in regards to the applied knowledge test, there's mainly two types of questions. There's a single best answer, and where you need to select one and only one answer from a list of usually 4 or 5. And then there's extended matching questions, where you may need to select more than one based on the type of question. All the questions are clinically based, and that's to reduce the likelihood of having isolated and non-clinical questions. But having said that, there's quite a few questions that are pretty doozy and require guesswork and elimination of the unlikely ones to arrive at the new correct ones. So in regards to the single best answer, there's either one correct answer or most correct out of the other likely answers. And that's something that the RACGP does play around a little bit with. So they, maybe 2 or 3 answers look fairly correct, but there's just the one answer which is the most correct one. The extended marking comprises of choosing the best options out of numerous options. All the questions hold equal value and there's no negative marking. So in regards to the domains of general practice, the assessments are based on the 5 domains and take into account the BEACH data. So you probably it would be advisable to compare your practice with the BEACH data, look out for things that you may not be seeing enough in your practice. But overall, the exams will cover all 5 domains, and they represent BEACH data's distribution of cases. So there's going to be lots and lots of general questions, very little things like male genital questions overall. In regards to hints and tips, the college is looking for breadth rather than depth of knowledge. I tended to use various resources, Murtagh, the Australian Family Physician, Check, How to Treat, up to date. But again, things like Check was way too in-depth. So you just need to know bits and pieces about everything and how to manage common things which occur commonly. There's quite a few previous examination papers floating around, and often a few questions are repeated. But if the RACGP noticed that a lot of candidates have answered a question really well, or if it's been repeated quite a few times, they tend to eliminate that question. And also, if a question is a bit dubious, or a lot of candidates are not able to answer it, then they also tend to eliminate it. So they have this sort of a bell-shaped curve that they select the questions from. What I did was I made notes on the often asked scenarios in terms of polycystic ovarian syndrome, the Rotterdam's criteria. I made notes on anemias, various arthritides, and thyroid issues, which sort of helps me quite a lot. Now, in regards to preparation time, there's different sort of people recommend different things. Some people are okay with 2 months of study, whereas others require at least 6 to 8 months. From what I gather, if you're putting in an hour or 2 every night, then 3 or 4 months is okay. But if you're sort of reading it sporadically, then at least 6 months of study is required. But again, it depends on your style of learning. You may tend to study every night or do well in a study group, whereas others tend to sort of do it alone and excel that way. You do need to go over the information a few times, because you do tend to forget a lot of the information, which I certainly did. So it's always good to make notes, and so that at the end you don't sort of are at a loss of where you are. Try and do practice exams in a timed fashion, so just time yourself and sit there for the 3 hours to actually try and get through an exam paper, and then mark yourself to gain some more confidence. So in regards to the actual exam, the computer program is actually really well designed, and they keep updating and improving the platform. So when you're sitting there, you've got in front of you a clock that shows the time remaining and the questions that you've already attempted, the ones that you've done and the ones that are remaining. Different color codes are used to delineate this information. So the ones that are already that are still present are in blue, and then the ones that you've answered go in gray, and the ones that you haven't, the ones that you have marked as go back to and refer, I think are in black, but that can change. But it is a very, very simple platform, so very easy, very user-friendly. You can actually clearly see the questions that you've marked as a review on a smaller panel, and you're able to jump to any question from this panel. So say I'm on question 3 and I just feel that I've got to come back to it. I mark it as a review, and then on the panel it gets marked as a review, which and then I can jump back to. So even if I'm on question 75 and I look at back at the panel and there's question 3 and 5 and 7 or whatever remaining, I can actually go back to that question and then review it at any stage of the exam. Also, the ones that you mark for review are not given to the examiner, so you can actually mark all of them as a review, and it doesn't sort of account for any mark. If I'm making sense.